Good evening and welcome to Let's Talk Health Insurance. I'm Gail and together we are GEL Health Advisors here to bring you valuable information on health insurance, including Medicare, dental, and so much more. We invite you to ask your questions. You can type your questions in the chat and Yesenia will read your questions or ask to be unmuted by raising your hand and Janet will let me know that you have a question to ask. So as we conversate here this evening, answering questions and making comments, please keep in mind that everyone's plan is unique to them. And so we will be available to answer general questions and to give more personal one-on-one advice and in different situations. You can always call us on our message center, which is 817-381-1500. In these times of the COVID-19 pandemic, it is more than important that everyone have health insurance. So we will be here every Monday night at 8 o'clock p.m. during this health season. So let's get started. So Terry, let's start by informing our guests of the importance of health insurance.
Yeah, so we know that health insurance is very important to ourselves and to our family members. And I just wanted to go over some of the benefits because I think that's probably most important to people and that hits home with most people. Benefits of having an ACA plan or health insurance, basically. So, with the ACA plan, you get essential health benefits covered, such as outpatient care, preventive and newborn care. You have lab tests that are covered. Hospitalization is covered. Mental and behavioral health treatment is covered. Services and devices to help with chronic conditions are covered, as well as prescription drugs. So I know that most people want to know, how they will benefit and what is covered under this plan. And these are just some of the items that are covered when you sign up for health insurance.
Okay, thank you, Terry. And um, and if you want to get more information from Terry, just give her a call and just ask for Terry. Jacqueline, would you like to add anything to what Terry just mentioned?
Just in terms of work-wise, basically a lot can change in just a second, including whether it's your job status or your health coverage. And right now, we're letting everyone know if they recently lost their job, they're in need of health care, that we can help them. We can get them coverage right now. And basically, we're the people they need to just call, get the information. Don't be scared. We're not going to be sending your information anywhere else, but we can help you get health insurance, which is so important right now.
Okay, great. Thank you, Jacqueline. Okay, so before we go any further, we're going to ask Janet and Sagania to give us a general overview of health insurance and Medicare. So as they get set up for that, we just want, when we talk about health insurance, most people just think about just health insurance, but it's more than just that. There's Medicare, there's dental, there's vision, and so much more that goes along with that. So Janet, are you ready?
Yes,
Okay.
ma'am.
All right, go ahead.
Alright. We will be talking about healthcare this evening. Um, with healthcare, there's usually an enrollment period that begins around November 1st, and, there also is a special enrollment period. Now, in order to qualify for that special enrollment period, these are the following things. If you lose coverage within the next 60 days or have lost coverage in the past 60 days, also if you recently gotten married, if you had a child, gained a dependent, got divorced or legally separated, and that's how you lost your health coverage. If you were denied Medicaid or CHIP, or even if you had a change in immigration status, those are the things that would qualify you for the special enrollment period. Now, the things that we would need in order to apply for healthcare are the following: full name, your social security number, your date of birth, those that are under the age of 65, those that are over the age of 65, Saganya will speak to you about what she can help you with. Also, address and county, your phone number, email if you have one, number of people on your tax return, yearly adjusted gross income, employment name, address, and phone number of that employment. Now, if you're self-employed, we would also need the type of job that you do. Those are things that we would need. Now, if you don't meet either qualification, you can leave your name and email at 817-381-1500, and we will get back to you and help you with what we can in order to get you that health coverage that you will need. Now, for those that are turning 65 and over, Ms. Saganya Grimes will speak to you.
This is C. Grimes, and I'm going to be talking about Medicare, the ABCs plus D of Medicare. If you're turning 65, if you've been on disability for 2 years, or certain chronic conditions, you would have Medicare Part A, Part B, and we would be adding Part C and Part D. Part A is your hospital coverage. Part B is your doctors, tests, and other durable medical equipment. Part C is your Medicare Advantage, and that often includes your Part D drugs as well. You have 3 choices. You can have Medicare, Part A and Part B plus a drug plan. That's considered original Medicare. You can have Medicare plus a supplement plan, or 3, you can have a Medicare Advantage, which includes a lot of times your Part D prescription plan. The Medicare plus the drug plan, that means if you have moved over from the health side to the Medicare side, you have 63 days from the time that you change to get a Medicare plan and drug plan. We also have 2, the Medicare, the supplement, and the drug plan, which is also called a Medigap plan. And we have the Medicare Advantage, which includes the Part D plan. If you have questions, you can also visit ssa.gov. They have a great explanation of Medicare Part A, Part B, Part equals C plus the D. Again, if you have any questions, you can feel free to call me, C, at 817-381-1500.
Okay, thank you, Saganya and Janet, for that presentation. And there's a lot to health insurance. We're going to talk a little bit more about Medicare, and then we're going to come back to the health insurance. Where is Joe? Joe, you've been working in the Medicare for quite some time. Can you give us, the audience, some insight on what's available under the Medicare part of health insurance?
Okay, sure. Thanks, Gail. Basically, when a person turns 65 and becomes qualified for their Medicare, then like we just showed the different options. If a person does choose to go with the Medicare Part C, where the approved insurance companies are going to manage your Medicare benefits, then it looks a lot and mirrors a lot like what we have traditionally when we're working on the job. So people like to come over and get the dental, the vision, having access to the nurse, also being able to take advantage of those preventative screenings without having to pay for them. So these are some of the benefits that come when you have that Part C plan. Also, if you qualify because of your income, we would like to do an assessment where we can kind of take a look at what you have. And there are different programs on the state side, as well as through Social Security, where if you have income that falls within a certain guideline, then we want to try to reduce your out-of-pocket costs on your prescriptions. And we've been able to get this down to under $8.95. So we have a lot of people that don't know about the programs, and they are paying a lot for those prescriptions, especially the 3 heavy hitters, which we say insulin, the eye drops, and the inhalers. So let us, the professionals, do the one-on-one assessments with you guys and see where you fall. There's a lot that you have with your Medicare when you've earned that right to get that red, white, and blue card. You've worked and all of that, but there's still a lot more. And so we would like the opportunity to see where you fall and try to get those added benefits that you come to expect. My name is Joe, and I'd love to meet with you. The number is 817-381-1500, and any of us will be able to help you. Thanks.
Okay, thanks, Joe.
Mhm.
Now, I want to stay on Medicare for just a moment. Stacy, when C. Grimes mentioned that there were 3 ways that you can have regular Medicare, you can get on a supplement, or you can get on a Medicare Advantage. What are some of the advantages for someone getting on the Medicare Advantage program?
Well, if they are 65 and they get the red, white, and blue Medicare card, they automatically get their health insurance through the federal government as long as they've worked 10 years. But that only covers 80%. And there's 20% left over. But if they go into a Medicare Advantage plan, for instance, then Medicare is authorizing a company, certain carriers, to provide the coverage for them. So they get the A, which is hospitalization. They get B, which is doctor's visits and dental, vision. And the plans do vary in what they cover and how much is covered. But they get more, I would say, more extensive plan than if they were to go with just original Medicare.
Right. That's good. And the thing I like about the Medicare, because I'm of that age, I have my Medicare card and I have a Medicare Advantage plan. And the thing that I like about it, because it has dental benefit, like she mentioned, it has the dental benefits, it has but this year has so many more things. You remember, people, just depending on where you are in your health stage, they have for people that need the pendant, the help I fall and I can't get up thing, they have that, and not just around your neck. You can get it like a watch, you can get it in different things. There's a lot of people that are seniors like I am, but they need transportation. And there are some plans that have unlimited transportation. And I don't care what kind of health condition you have, we can put you on a Medicare plan with no problem at all. Can somebody else help me think of some of the other little perks we get with the Medicare Advantage plan? We got dental vision, the personal alarm system. What else do we have? Anybody?
Over the counter catalog.
Oh yeah, over the counter catalog. I was looking at some of the plans for 2021. You can get up to $1,000. Some of them will let you go in different stores and use your card to buy things. So you have some of them have a card with an extra $150, it's an extra $1,500 on some of the cards. I mean, it's a lot out there. Chiropractic. There are even some that if you need, like, if you're taking a shower and you need to put the different bars up so you don't fall, there are some programs out there that will pay for that for you. If you need extra help in your home on Medicare, the more you need, the more Medicare can provide for you. So please call some of us. There are a lot of benefits that people have, they're just not aware of them. That's why we're here doing Let's Talk Health Insurance, because we want to get the word out to people that all of these things are available to you. Now let's switch gears for just a moment, and we're going to talk a little bit about, we're going to go back into just health insurance.
Ms. Gail, someone's asking about hearing and acupuncture.
Okay, what, read the question.
It just says hearing and acupuncture.
Okay, yes, there are plans. That's why you would call one of us. We'll do, like I think Joe mentioned, we'll do an assessment and see what you need. Some plans you might have to make a co-payment. There are other plans that will pay up to, I think, $3,000. Now, don't say, yeah, I called. She told me it will pay $3,000. It depends on where you are in your assessment. But there are plans. We will look for the plan that will give you the benefits that you need. Our thing is to get you close to zero as possible. And yes, there are some plans that will get you acupuncture. So you think of it in the health arena, it's out there. You just have to ask us. If it's not there, we'll try to find it for you. Thank you. Do we have another question, Yesenia?
No, ma'am, that was it.
Oh, okay. I'd like to go to Ignatia. If someone, let's go back to the health insurance. Like I said, with health insurance doing open enrollment, which is for health insurance, annual enrollment, which is the Medicare. Let us know what those times are, Jig, and sort of give us some more insight on the health insurance, because you worked real heavy in that area.
So the open enrollment, annual enrollment starts November 1st, and you have until December 15th to enroll, and the plan will start January 1st. We have, the plans are based on the counties you live in your state. So you could have maybe multiple carriers that are offering coverage for you. And you get also add a dental and a vision this year coming up. Ambetter is coming out with their own, if you have Ambetter, you can be able to add dental and vision. And let's say next year you already have a coverage, but mid-April you lost your coverage, then it's like a special enrollment period starts, for having special reasons. You lost your job coverage, you gain an immigration status, you just got married, you adopted a child, you moved from one state to another, and many more special reasons where you will be able to enroll in a ACA Affordable Care Act plan.
Okay, great. Yeah, and I like that what she said. A lot of people on the health insurance, a lot of people that are losing their job now, sometimes we miss them by a day. We have a certain time that we can, soon as you lose your job, soon as you lose your insurance, you should be calling us, because we have a certain time. We need certain documentation for you. And some we have missed by a couple of days. And at the end, I remember the end of September, I was up late. I had 2 minutes to get somebody in, but we were able to get that coverage started the 1st of October. So soon as you find out somebody lost their job and they had insurance on the job, let us know. Call us at the 817-381-1500 number. Now, doing open enrollment, like she said, we can write everybody qualifies. Now, some people think that it's too high. And we're here to tell you that most of the time they are wrong. We have plans for everybody. We have a saying that we can insure 99.99% of everybody, and we really can. We can get you something on that. Anybody else want to add something on the health insurance? Patricia Parker.
I would just like to let everyone know that it's definitely very important that we all get insured. Because a lot of times, as Gail and others have said, we think we can't afford it, but you won't know unless you let us help you. So be sure to call us, and one of us will be glad to help you. Call us at 817-381-1500.
Okay. All right, and then Deborah had a situation today where she was excited because now we're going to jump back and forth on Medicare and health insurance. One thing, I can't hardly stay on one subject, but we're going to jump back and forth. We're going to go on. Deborah had a situation today. She was excited because she was able to help someone on Medicare and get them started with health insurance. Tell us about that, Deborah.
I had a client call me. It was a referral. She had just got her red, white, and blue card. Just became disabled. She got a red, white, and blue card and wanted to know what she had to do. So I took her information, got all her, took intake sheet, got her name and number and all her information that I needed to work with her. I told her I would give her a call back tomorrow because I wanted to do some more research on her. But I was so excited because she had her red, white, and blue card effective October 1st. And I told her I would get back with her first thing in the morning. But I wanted to make sure I had all the information I needed from her and to do my research so I can get her the best to right plan for her.
Okay.
Mhm.
And that's what we're here for, to help people. And staying in the vein of Medicare, this year, now I've been around for a while. Back in the day, we used to write people that were on end-stage renal disease, and then they stopped us. But now for 2021, anyone that's on end-stage renal disease, we will be able to put them on a plan, give them a lot of benefit. I know a lot of people that have problem with transportation. There are some plans that have unlimited transportation. So getting back and forth to get your treatment is not going to be a problem. Now you have to live in a certain area where these plans are. That's one of the things about Medicare, these Medicare Advantage plan. That plan has to be available in your area. And we don't just put you on a plan. We, like Joe said, we give you the assessment. We make sure that the doctors that you need are on the plan. Now, there are doctors in every category on every plan. So we might have to make some adjustment, but if you just need a doctor, we're gonna go through the list till we find. We have to, on Medicare now, on health insurance, we don't have to do it, but on Medicare, we have to check your medicines and make sure that your medicines are there. And all the medicines are on every Medicare plan. Again, some adjustment might have to be made, or we might have to send some letters and say, hey, Miss Jones really need this, even though you don't carry this in the brand name. Miss Jones really need this. So we'll go that extra step to make sure we can get that medicine for Miss Jones. So we are really excited, and we really enjoy what we're doing. In addition, have any of you, I'm not sure, have any of you all had an experience where you helped veterans? I think Peggy works most with veterans, but now on the ACA, we can't put veterans on that plan, but on Medicare, veterans, we can give them the plan and say, well, they don't need, they can get more benefits. They can get the dental, they can get, they might want to go to Walmart instead of having to go to, the Veterans Administration to get their medicine. And if it's a brand, if it's generic, it's zero anyway. So they can go there. They can see doctors. And we'll just call us if you're a veteran, if you know any veterans that need extra help, things like that, we can assist them also. So with the veterans and helping people on end stage, see, when we said no pre-existing, all pre-existing, we can't just say just for ACA, has to be for Medicare too. So that was brought out. So pre-existing, but the thing is to get it in time, make sure that you don't miss those times. So October, let's see, Debbie, when is it that the Medicare starts? What's the open annual enrollment for Medicare?
Excuse me, October 15th.
Okay, through what's the end date for it for the annual enrollment? October.
December 7th.
December 7th, yeah, now for Medicare, it's October the 15th through December the 7th. They give us just that little short window to write out everybody. So we're working hard to get there.
Ms. Gale,
Um,
someone asked, will the veterans have to pay out of pocket for any other benefits outside of what the VA offers?
Most plans, no. Now that some of the plans do have a co-payment, but most of them have a 0 monthly premium.
I had a
Okay,
couple.
go
Yeah,
ahead.
I would like to say one thing on it. As long as they're paying the Part B, according to whatever theirs is, because I know I had a client, you have some people that want to do it, but if they don't have, they know they have to have A and B, as long as they're paying that Part B, because some veterans will want to get into the plan, but they don't necessarily want to pay for the Part B.
Yeah, you have,
yeah.
yeah, you have to have the Part A and B. Even to be on the veterans plan, you have to have the Part A and B. So that might be a co-payment. Most of the time on the veterans plan, to go to primary doctor 0, your specialist could be anywhere from $15 up, but your specialist is right here. But you might have dental benefits anywhere from $500 to $2,000 dental benefit. You don't pay anything for that. So it just depends on first again the plan that you choose and where you're, if it's available in your area. But for its monthly premium, no extra money. You can have it always.
I've helped a veteran, and they are very happy because of the dental. They don't have much dental coverage at all, so they're very happy to get the dental benefits with the Medicare Advantage plan.
Okay. We've had some, I have some veterans that are on the plan just so they can go to the gym free. With a lot of the plans that we have, you can go to 5 different gyms a day if you wanted to, because it's available and there's no charge for it. So there are a lot of benefits. Just call and let us do an assessment and see what you have, what you need. Now on the health insurance side this year, there are some plans that are going to have the fitness center tied to those also. So the plans are looking real good in that area.
Ms. Gal,
Yes.
you have a Q&A. You have a question. Is what qualifies you for Medicare and Medicaid?
What qualify you for Medicare and Medicaid?
Yes. Do you want them to ask the question or just you?
Yeah, they can ask it. Just unmute them so they can ask.
Okay. It is Esther Reed.
Okay. Esther, unmute yourself, Esther, and ask your question.
Yes, I would like to know what qualifies you for Medicare and Medicaid.
Okay. C. Grimes, would you like to take that question?
Sure. For Medicare, you would need to have your Medicare card and have Part A and Part B. You normally receive your Medicare card when you turn 65. You also receive a Medicare card after being disabled 24 months. So 2 years after being disabled, you will also receive your Medicare card. As far as Medicaid is income driven. So we would have to do an assessment with you to see what your monthly income was, because there are different levels of Medicaid. We have the full Medicaid, we have we call them Quimbies and Slimbies, but those are different levels of Medicaid, and we have the extra help, which is a level of Medicaid. So the Medicaid has different levels, but we would have to do an assessment so that you would be able to apply for Medicaid and see which level you qualified for.
Thank you very much.
Okay, Okay, yeah, so just give C. Grimes a call at 817-381-1500, and she'll be glad to do that assessment for you. Well, a lot of people qualify to have that 144 or whatever, take their Part B. They qualify to have that paid for them, but they don't know it. So that's why we're doing this Let's Talk Health Insurance, because we can really help them. Even if you didn't, you still had to make your $5 copay to your doctor. If they were putting that $144 back into your Social Security check, that would be great, wouldn't it? So a
Yes.
lot of people qualify for that, but don't know it. And we have a system where we can put that in. We get information from you. We put that in the system. In about 2 weeks, you'll get a letter in the mail. We want you to open that letter and read that first page to us. And whatever you tell us on that first page, we pretty much know what you're gonna get. It might not be that clear to us, but we're happy, we're smiling because you can't see us through the phone, but we're happy because we know we're getting ready to save you a lot of money, and we can do that real easy, real easy. So like I said, it's just so much with Medicare that we can do, and we can really help. We love helping our seniors, especially since I'm one of them. So we really love helping our seniors out there. But
Miss Gail, if I could just share real quick, I know you said that with the silver sneakers that there were like 5 gems. One of my clients actually called back and she was excited because she received a home workout kit. And she really enjoyed that, and it was helpful through the COVID when everyone was quarantined. She was still able to meet with some of her members, and they actually completed the Zoom workouts at home. So she was excited about receiving her home workout kit. I think she received a scale and some weights and just a little kit. Yeah, she was excited.
Oh, okay, I gotta go get mine then. That's great. That's awesome. And that brings up a good point too. Because of the COVID, we're not actually going out as much as we do. So we're meeting people over Zoom, over the phone. We can do applications, and they have set up where we can just get your voice and that'll be your signature. So we still can and service. And then in some instances, some of the agents are still they're like the mechanical man, but they're fully dressed, but they're out there to make sure that you get what you need on the things that you have. Speaking of all we can save on Medicare,
I got a question.
mhm.
I got a client that her birthday is in December, and she has a red, white, and blue card, and is effective December the 1st. Should she wait till AEP, or can we go ahead and write her now for it to be effective December 1st? What is her best advantage?
In her situation, she has more than one opportunity to enroll. She has the annual enrollment, then she has her first time going into Medicare enrollment. But my thing is that if her, regardless of when her birthday is in December, on December 1, she qualifies for coverage. So we want to cover her on December 1. We don't want her waiting to January, because if something happened before in December, if she does not have a Medicare supplement or Medicare Advantage and her prescription program, she's going to be out of pocket. So our thing is we try to get people as close to zero as we can. So we want to get her covered the 1st of December.
Okay.
We definitely want to get her covered the 1st of December.
Amen.
So I'm going to go back to C. Grimes on this next one. Now, we talked a lot about how we can help people with on the Medicare side. How can we help people save money on the health insurance side during open enrollment?
How to help them save money on the health insurance side? Let me see.
With that subsidy.
with the subsidy, because with the health insurance, the Medicare plans, it's based on their income and the number of people on their tax return. So of course, basically we have a person that's a single mom with 2 children, and if her income is around $18,000 to $24,000, she would get almost full subsidy for her insurance. And with those children, the system automatically sends them over to the Medicaid side. And if they qualify for Medicaid, then the children are covered under Medicaid, and she would be covered on the health side for her.
Okay. Now, what if they decide that the children don't qualify for Medicaid? What happens then?
Then they call us back again, and the children will be covered on her affordable health care plan as well.
Okay,
and of course,
right.
those plans, like I said, this year we have some with vision, dental benefits, and a few, like you said, that have the gym benefits on theirs as well.
Mm-hmm. And I like the health part really takes care of the children, because the children have to have the dental. I don't care what plan we put them on, they have to have that dental benefit.
Ms. Gal,
So
someone asked if that's based on demographics.
the plan, no, everybody gets the subsidy. If you qualify for it, you'll get the subsidy. It doesn't matter about where you live. It doesn't matter which plan that you're on, especially in the state of Georgia. We got all states covered, all areas covered in Georgia. Yeah, all counties are covered now. So it doesn't matter if you qualify for the subsidy, and we have the programs that can let us know real quick, you know, where you qualify. We know how to write those up. What people don't realize is that we have to do about 15 certifications every year just to do Medicare and ACA. I mean, long certifications. We cry sometimes, but we get through them. We have to make a certain grade. If we don't make a certain grade, we can't do it. And we have to do this every year. I've been doing it since 2009, and I still have to do it every year. And they want to make sure that we know what we're doing. So yeah, a lot of people qualify for health insurance, and sometimes, again, don't go quote me, but sometimes it's zero, and they don't even realize it. And then when they get it, they say, oh my goodness, you mean I got it for zero? If what you told me was true to the best of your knowledge, and when you file your taxes, if they come in line, yes, you're paying zero because you qualified for subsidy to get your health insurance. Okay, are there any anything else in the chat? Yesenia?
No, ma'am, that was it.
Okay. All right, so I have so much that I'd like to talk about on health insurance. I could talk about it all night, but I just want everybody just go through and just do some closing comments. And if we have some questions that come up, that's fine. Let's start. I'll just start at the top with C. Grimes.
Well, we want to thank everybody for participating tonight. And of course, if you think of any questions afterwards, you can always call us at the 817-381-1500. We're available to help in any way that we possibly can.
Patricia, Miss Patricia Parker.
Once again, we'd like to thank you for coming, and feel free to invite anyone that you know that may have questions, because a lot of times people ask you questions, you don't really know the answer, but you can direct them to come to this meeting on Monday night, and we'll be more than glad to answer any questions they have. And perhaps they may need to call the number, which is, as C. Grimes said, 817-381-1500.
Miss Jo.
All right. I'd like to just echo what I've heard. Thanks everybody for tuning in, and just remember that we are professionals. We have gone through getting licensed and appointed, and we're certified with all the information that's out there. Let the professionals help you guys. Don't stress over it. We take really good care of you. And we welcome you to give us a call. We do the one-on-one assessments. And so we take all of the hard stuff out of it for you. So please give us a call. We'd love to assist you further.
Stacy?
I just wanted to say one more thing about the veteran benefits for someone who's on Medicare. I worked with a couple this year, and the husband had been retired a couple of years, and his wife had just retired. And it's never too late to take advantage of the veteran benefits, even if you've been retired a couple of years. And also spouses get the same benefits that the person who was in the military, the veteran, will get. And I want to thank everyone for coming out tonight and taking your time out of your day to listen with us. And we hope to see you again next Monday.
Deborah?
Let's join us and let's talk health insurance and Medicare. We'd like to thank you for joining us tonight. And always, we'll be here every Monday night at 8 o'clock. And call a friend and tell them to join us also. And if you have any questions tonight, feel free to call 817-381-1500. And thank you so much.
And we're thankful for our assistant, Yesenia, that's keeping up with your questions. So just wave your hands to Yesenia so they'll know who you are. We'll get her to talk next time. And Janet. No, you can say something. You've been around.
Yeah, we'd like to thank everyone for coming out this evening. Like it has been mentioned, take time to get information that you need, or for even loved ones or even friends in regards of healthcare, Medicare, Medicaid. The more you spread it, the more information will be going out, and let them know that we can always help them, even if it's just a question that may sound that to an obvious answer. They can always ask that question, and we're always here to help no matter what. And it's a privilege to be able to help you, because that's what we love to do, help everyone as much as we can. And we also show lots of love at the same time. It's a privilege as always.
All right, all right. You can call us anytime, because that number, it won't wake anybody up. If you get a question in the middle of the night, just call that number, because it hits a computer system. Cause it will let someone know that a call is out there, but we won't answer it until in the morning, and we'll get to you. So you won't wake anybody up if you call that number anytime, day or night. Miss Debbie.
I would like to thank everyone for coming out tonight, and I hope you guys got a chance to see that how much experience you have behind each one of us, because if you add it up, it's probably over 50 to 75 years of experience, but we work together to better service our clients at all times. You're first.
All right.
And thank you again.
Okay. Miss Jacqueline.
Yes, hi. I just wanted to say that it's been great talking to you guys tonight. But there was one thing none of us touched on and I forgot about, but it's just the anxiety and depression that everyone's having right now. Just want to throw a number out there. It's 1-888-771-5166. Again, that's 1-888-771-5166. And that's just a number for you in case you're going through some rough times and you just need someone to talk to. There's always someone at the end of that phone to answer. Having nothing to do with us, it's just an anxiety and depression hotline. And thanks again.
Miss Terry.
Yes, I want to say again, thank you for joining us tonight. We look forward to hearing from you and seeing you in the weeks to come. And also tell your friends, invite your friends.
Okay. And someone just told me to tell everybody thank you. One of our guests told me to tell the panelists thank you. Okay, Miss Connie, we have a lot, Connie is new, not to insurance, but to our group. And Miss Connie, we haven't heard anything from you tonight, so.
I know I've been listening and learning as well, but I just want to thank everyone for participating and for joining us tonight. Just during these uncertain times, let us explore what coverage we can provide to fit you. Everyone have a different need. It's not a one size fit all different situation. So, like I said, I've learned a lot, and want to thank you all for participating and coming out, and tell your friends that we'll be here in the following Mondays to come. Thank you.
Okay, and Ms. Jignatia Patel.
I just want to take this opportunity to thank everyone for sharing your experience platform. And also, it's been really privileged to share the same stage with you all. And I want to also encourage everyone that you have friends or family that you feel like they have questions, but they haven't found an answer yet. One of us out of our group will definitely be able to answer those questions. So bring them next time. Every Monday, we're here at 8 o'clock in the evening. So please encourage your friends and family to come. And you can also call at 817-381-1500. Thank you.
Ms. Gail, someone asked if you offer diabetic shoes.
Yes, we do. If you're diabetic and if you are on Medicare, we can get those for next to nothing. We can't say free, but we can get them for next to nothing. Read between the lines. So give us a call at that number that's probably etched in your brain by now. But if for some reason you forget, you can go to our website, which is GEL Health Advisors, GEL healthadvisors.com. So we want to thank you for coming. And if you have a forum at your church or your organization that you would like for us to come on and do a Zoom at your event, we we call ourselves agents with a servant's heart. And that's what we really do. We want to educate people because we have not, because we ask not, and sometimes knowledge is the key. So we just want to get the knowledge out there so we can help everybody. So we just give us a call and we can come on your event and give some information too. So join us on next Monday night, and the same Zoom link that you did tonight, the same Facebook link for Let's Talk Health Insurance next Monday night, 8 o'clock. Have a good night.
Thank you.
Bye.
Good night.
Bye.
Bye.
Bye.